Hello and welcome to our third episode for the community's Grand Cycle It under 8 minutes. I'm your host, Chinmy Kumar from the Asia Pacific Regional Learning Hub. In our previous episodes, we have covered HIV and tuberculosis as our topic, but today we tackle the topic of human rights, the foundation that makes those programs actually work. To help us navigate the must know of human rights in Grand Cycle 8, I am joined by Alexandrina Iovita, Senior Technical Advisor for Human Rights at the Global Fund CRG Department. Alexandrina, welcome.
Thank you so much.
Thank you. Let's straight jump into our three critical questions. My first question to you is: what is new in Grand Cycle 8 for programs to reduce human rights barriers to HIV, TB, and malaria?
So what is new is that the human rights module is now part of a modular framework for resilient and sustainable systems for health. That allows us to be able to also plan for human rights responses across the three diseases, as well as specific focused efforts to remove human rights related barriers as part of systems approaches. That does not mean that we're losing disease specificity. We're still able to use a human rights module, say as part of your HIV focused response, as part of the package services for HIV key populations, or plan for and budget for specific efforts to reduce TB-related stigma, for example. But it means that in line with a strategic shift that Global Fund has proposed for Grand Cycle 8, the one on integration, we're also able to have these cross-cutting efforts. And we're able to do both. We're able to plan as part of a more systematic approach to resilient and sustainable systems for health, as well as ensure that our specific human rights programming is integrated as part of a disease packages. What's also new is that now we have 3 interventions. In the past, we used to have 8 for HIV, 9 for TB, 5 for malaria. What we have now is 3 higher level interventions, which basically include all the previous work. It allows us to be able to have more integrated and systematic approaches to removing human rights related barriers to services. The first intervention is around ensuring that we reduce stigma and discrimination and have access to quality, non-discriminatory healthcare. In order to do so, we still need to address stigma and discrimination in all settings. We still need to ensure that capacities of healthcare providers are there. So basically, the previous interventions roll up nicely in the new higher level intervention. The second intervention is around ensuring that we have good laws, policies, but also the enforcement in place. So that includes the previous efforts around monitoring and law reform, as well as efforts around engaging with law enforcement and ensuring that the law enforcement actually enables access to healthcare rather than violates rights. And the final intervention is around ensuring that we have both knowledge of our rights as well as access to legal services, access to justice. So that again brings together elements of previous interventions. So what's new is basically building upon what has worked in Grand Cycle 7, including building upon existing mature programs that have demonstrated their effectiveness. The intervention that we used to have around removing gender-related barriers is now part of a new gender module, which is going to be the object of another podcast. So you'll hear much more about it from my colleague Fia once you have the opportunity to engage with her. But basically, key messages to remember. What's new is a module that is part of a resilient and sustainable systems for health. So communities should ensure that they participate in the discussions of that particular RSSH subgroup, not just in disease-specific discussions, and use those higher level interventions to be able to plan for the most effective, for the best value for money kind of interventions. The guidance that we have is helping us prioritize better, is helping us build upon greater effectiveness of intervention, as well as look at the things that we can deprioritize or things that we can do to integrate and increase efficiency of interventions, including be more in line, in step with national systems, with national infrastructure for human rights agenda. So that's what's new in a nutshell.
Yeah, it's encouraging to see like a stronger mandate for removing barriers. But Alexandrina, we cannot ignore the elephant in the room, like given the deteriorating context and like financial pressures. Which human rights program should be prioritized in Cycle 8 according to you?
Thank you so much. Yes, indeed, we're seeing a lot of financial pressures. We're also seeing more need for programs to reduce human rights related barriers than ever, because we're seeing much more difficult contexts in so many countries. We're seeing that the anti-rights movement has really deteriorated the civic space where our communities operate, have deteriorated sometimes our laws and policies and our ability to actually deploy non-discriminatory healthcare, which are all arguments that communities should use in order to make sure that programs to reduce human rights related barriers continue to be prioritized despite the pressures on the allocation. Our guidance for Grant Cycle 8 recognizes programs to reduce human rights related barriers as part of enabling impact. So that's an important entry point. We need to ensure that we show the clear link between programs to reduce human rights related barriers and the impact that we're trying to enable. And to do so, we need to choose those programs to reduce human rights related barriers that are most effective, most attuned to the specific context in the country, and most able to demonstrate the greatest value for money. In order to enable access, but also acceptability and quality of health services, it is important for us to focus on the empowerment of individuals themselves, so individuals to be able to access healthcare, to be able to navigate those barriers that exist, or to be able to seek help, to seek redress if their rights are being impeded and they are not able to access healthcare. It's also important for us to prioritize specific beneficiary-facing interventions that help them do that. For example, community paralegals, an example of how we can have low threshold access to legal services to help people navigate the system. Or use of community-led monitoring, not just to record violations of human rights, but have clear pathways of access to redress. So bottom line, think through what is your pathway to change, what is your pathway to ensure access to health services when you make an argument to budget for programs to reduce human rights-related barriers. What's also important is for that access to services to be safe and secure, both for users of services themselves, for our affected communities, as well as for providers of services. We want healthcare providers to be safe, including and particularly community-based service providers. We want paralegals not to be arrested themselves because they are human rights defenders. So it is important to build for safe and secure service provision, to build for models that work in the current context, to think about aspects of, say, digital security when you plan for digital outreach. So safety and security is an essential investment to remove human rights-related barriers to services. It's also important for us to continue focusing on those community structures that have demonstrated their resilience, that have demonstrated their effectiveness in reducing human rights-related barriers to services and in helping people in navigating for greater access to healthcare. A recent rapid assessment that was conducted by the Global Fund Evaluation and Learning Office has demonstrated that such investments in community systems are among most resilient and sustainable, which is another argument that I would encourage communities to use to be able to prioritize for specific programs to reduce human rights-related barriers in such resource-constrained settings.
Yeah, thank you so much for your response, Alexandrina. To be very honest, like prioritizing programs is one of a very important and burning question for communities. But when we talk of programs, I guess there is also a lot of question coming on what kind of data or arguments can communities use to advocate for human rights integration in national HIV, TB, and malaria responses.
Thank you. Yeah, indeed, it's going to be a really important priority to use all the arguments and all the data that we have at our disposal to build some really cohesive and strong arguments. Just saying that this is the right thing to do is not going to work. We realize that in resource-constrained environments, where there are so many difficult choices to be made with little resources, we really have to show how the investment that we are asking for is the most effective, is the best in terms of reaching people, is in terms of ensuring access to equitable access to healthcare. Which is why the arguments that should be used should always clearly show how programs to reduce human rights-related barriers enable access to services, enable uptake, enable retention in services. So basically that clear link to the health outcomes. Not just because investing in communities is the right thing to do, not just because investing in programs to reduce human rights-related barriers is something that we've done forever, but because these are the most effective modalities to ensure that communities are able to have better health outcomes, able to enjoy the highest attainable standard of health. So that's the key argument that I'm really hoping communities can use. The second argument should be around how do we integrate programs to reduce human rights related barriers so that they are not seen as a sideshow. They are not seen as an add-on. They are seen as core to the programs to reach key populations, to the programs to enable better health outcomes. So either this should be a way of integrating human rights legal literacy as part of the key populations prevention, or invest into polyvalent cadres, peer cadres that don't only do HIV or TB outreach, but are also able to do outreach around people's rights, are able to document human rights violations, are able to provide that low threshold service provision, such as community paralegals, as we were discussing earlier. So that's also a really important argument to use. And finally, the really important argument to use is who has the best track record in reducing human rights related barriers. For specific programs, such as capacitating healthcare providers so that they can provide non-discriminatory care, they can provide key populations friendly services, they can provide tolerant and quality healthcare. Ministries of health or existing in-service and pre-service education are the best placed to do such interventions around capacity building. Communities can play a really important role. They can bring their lived experiences to the table, but they are not the best place to do the capacity building itself. They can be the experts, they can be the ones contributing to the training, but institutionalizing such capacity building is a more sustainable approach to capacitating law enforcement or capacitating healthcare providers. Other programs where we talk about enabling access to healthcare for individuals, are programs that communities are best placed to deliver because they have a best track record to ensure that they reach the people from their communities with the kind of interventions that work best for the communities. And that's where the lived experiences of communities are absolutely indispensable. So basically, choose the right implementation arrangement for a more sustainable modality. Work with existing systems and partners, such as national human rights institutions, in order to ensure that you have a sustainable approach to reducing human rights related barriers. And for the evidence, for the data, use community-led monitoring, use stigma index, use any kind of systematic evidence, systematic collection of data on lived experiences of communities, because this is powerful and it shows that communities are experts.
Yeah, I guess. Thank you so much, Alexandrina. Like you have definitely reminded us that human rights are not just a moral issue, but a technical necessity for ending these three diseases. To our listeners, please share the video with system representatives and human rights champions. Ensure your voice is heard at the decision making spaces. Subscribe to our YouTube channel and join our newsletter page. I am Chinmy Kumar. Let's keep pushing for a right based response. See you in the next 8 minutes. Thank you so much.